Hi, I'm Rachel, the triage nurse here at Birmingham St Mary's Hospice. Some of you might recognise me from the letters and envelopes that we sent out regarding the Comfort and Care Appeal. I'm here today to say thank you. Thank you so much for all your donations. With everything going on during this pandemic, we appreciate everything that is given to us. We're aware that everyone's got financial worries and concerns at the moment, and we appreciate everything that's being donated. During this tough time, the hospice has gone through a lot of changes. One of those being our visiting restrictions. The nurses have adapted and tried to maintain relationships for our patients and their family members that may not be able to visit like they usually would. And this money will really help to keep people comfortable in the equipment that they need to support them while they're with us. I will take you through shortly to show you what the money has raised and what equipment we've been able to buy to help our patients. So you're now here with me in one of our bays here at St Mary's Hospice, and this is the equipment that your wonderful money has brought for us. We've got these brand new beds and mattresses that will benefit all of our patients. The patients are now able to use the sides of the bed to control the bed themselves so that they can use it and they can make themselves comfortable without necessarily asking for a nurse. For some patients, that's really important to keep that independence. However, if a patient does need our assistance, the bed can rise, it can move, and we can handle the patient safe and make sure their symptoms are controlled. A lot of symptoms our patients suffer with is breathlessness and pain. If you're in bed and lying too flat, breathlessness isn't going to be controlled as well. So being able to sit people up in a chair position using the controls is one of the best things that we can do to support our patients with symptoms such as breathlessness. So also the mattress that we got with them as well are able to relieve patients from any pain and discomfort from any pressure sores they might have. Patients that aren't eating and drinking as much, that are in bed a bit more often, which is some of our patients, their risk of pressure damage is so high, and it can cause more complications at the last days and hours of life when really the patient doesn't need any more complications. This mattress will really help to prevent those from happening and help the nurses look after sores that may already be present. Some other equipment that's still on our wish list to buy from this appeal is things like this, the Sara Steady. The Sara Steady is a mobility equipment for mobility which will help patients that still have their upper body strength to be able to pull up, take a seat on these two seats here, and then let the nurses move them around the hospice. That gives them their independence to get into other places of the hospice, such as the garden or the conservatory. Another bit of equipment that is on our wish list is some more syringe drivers. Both these equipment we do have, however we need more. This equipment is vital to help administer drugs to patients that might not be able to take medications by the traditional oral route. This is so important for patients that we have here that have got complex symptoms and they need their medications increasing and decreasing on a daily basis. This can include pain relief, medications to help relax patients, medications to manage patients' secretions, and then nausea and vomiting. This equipment is vital, and if you have any more that you can donate to us to this appeal, please do so. As you can see, we've already bought some amazing equipment with the donations received from the Comfort Care Appeal. However, we still have a few more things that we really need to buy. Machines that will help give patients medications when they can't swallow. Equipment to help move patients around the hospice so they're not just in their bed and in their room the whole time. Any donation that can be made, I'm aware that this is an extremely tough time for everybody, but please, if you can, donate. This can be done through our website or contacting our fundraising team. Thank you again for everything that you have done. I can't express how much me and the team here at the hospice appreciate all the support given for this appeal. Thank you so much.